I'm Ramona, and welcome to Ramona Interviews. And with me in the chair today is Carla Kenney. She is a cognitive behavior therapist, and we're going to have a great show today.
I started as a psychology major at UMass Lowell, and I thoroughly enjoyed psychology, and I knew that I wanted to go into that field. And I knew that I wanted to also get a higher degree. And there was an opening at the OCD Institute at McLean Hospital, and I said, great, let's try that out. And that was really when I first started to get hands-on experience working with people who had OCD. And I knew from that experience that I wanted to move forward and become a therapist that specialized in OCD treatment.
And explain to me, what is OCD?
OCD is obsessive compulsive disorder. It is basically defined by someone who suffers with having obsessions and compulsions, and the obsessions and compulsions cause a significant amount of distress. It interferes with daily functioning.
Could you give some examples? And you have to have both of those things? It has to be both?
Yes, usually it is. So, for example, someone who may be fearful of germs, that's actually one of the most common symptoms. When people hear OCD, that's usually the first thing that they think of. Oh, that person probably is afraid of germs and they wash their hands all the time. So that would be one example. However, there are many different faces to OCD. So for someone who was fearful of germs, for example, they would avoid touching doorknobs, may avoid going near trash cans, would avoid, walking down streets, things like that.
Walking down a street?
Sure. They're worried about people maybe spitting on the sidewalk, the germs on the ground, germs of people walking by them, things like that.
Okay. So they're limiting their behavior because they have a fear of something and it becomes compulsive because it stops them from doing something? How does that work out with the two components?
They would have a fear, let's say, for example, it's just different for everybody, but maybe, for example, a fear would be that they are afraid that they will get contaminated by some sort of a germ and they would get sick and possibly end up in the hospital with some very bad infection and the fear of dying.
Okay. And what other, let's stay with OCD for a minute.
Sure.
OCD between children, teens, and adults, how does it differ? Does it differ? And does treatments differ?
I would say that it really doesn't, there's really no difference between children, teens, and adults in terms of their fears. A lot of kids have fears of going to school because of germs at school, where maybe adults have fears of going to work because of germs. But the symptoms alone are not really different. The treatment is also not very different. You just have to kind of tailor it down so it is something that's understandable for that child.
Okay. So you work with, and is it true that you work with each patient a little bit differently? It's a tailor-made program
Absolutely.
For every person?
Yeah. Yes, absolutely. Everyone has different set of symptoms, different set of compulsions, different personalities. Their symptoms are often in different places. Some people have symptoms that are primarily in the home environment. Some people have OCD symptoms that are in the work environment or in the school environment. Some people have symptoms that are across the board in all different kinds of environments. So each person has to be treated differently. Specifically, their treatment plan needs to be tailored to what their symptoms are.
When you talk about cognitive behavior therapy, could you kind of walk somebody through how that differs from what people might think of as normal therapy?
Okay, sure.
Or whatever normal therapy is. I don't think there's any real normal therapy.
Well, what we do is we call it talk therapy. So there are a lot of clinicians that are out there that are fabulous, but a lot of them don't do cognitive behavior therapy. More so they are talk therapists. They may kind of talk you through some of the problems. Cognitive behavior therapy is much more structured, and what happens is someone will come to you with a set of problems. For me, it's usually someone who has OCD because that's primarily the population that I work with. And what happens is they come in and they have a set of problems, and instead of talking about what's going on, how their week was, talking about their childhood experiences, we really take a look at what they're experiencing, the distress that they're experiencing from their symptoms, and we work on that specifically. Cognitive behavior therapy challenges the faulty thinking patterns that everybody has. People without OCD have faulty thinking patterns, and they cause us distress and anxiety and depression. And we take a look at that. We help the individual identify those cognitive distortions, and then we use behavioral tasks, and this is the behavioral piece in cognitive behavioral therapy. We have them actually doing tasks that will prove to them that whatever their worst fear is may not actually come true.
So it might not be as bad as it is because you kind of walk them
Yes.
through it step by step.
Exactly.
Is there a particular time length for a course of treatment?
It really varies from person to person. I have worked with someone for 3 months, and I can work with someone for over a year. It really varies on the person. It depends on the person's motivation level. It depends on their ability to grasp the cognitive behavior therapy. It has sometimes to do with medications. Sometimes it has to do with their health in general. Sometimes I work with people that have a lot of health problems, and they can't see me on a regular basis. So, things kind of get pushed back a little bit, and progress may be a little bit slower, but it really depends on the person.
How much participation does the patient take in cognitive behavior therapy?
100%. Part of cognitive behavior therapy is actually assigning homework to the patient. And this is something that they need to do on a daily basis. And it helps them learn things, or practice the things that they learned in the therapy session, and they take it home with them and they start doing it there. For example, at the OCD Institute, which is an intensive treatment program in Belmont, Mass., they have 2 hours of coaching, doing exposure treatment with the coach, and then they have 2 hours of doing it without. And the purpose of doing it with 2 hours, without a coach for 2 hours, is to help them gain confidence so they can do it on their own when they transition home. So for me, when I'm working with someone, I give them homework, and they are to practice that homework on a daily basis when we're not in therapy, because that will also help them progress further.
How does this support work? How does a support group work? Is it only the therapist and the person? Do parents get involved when it's children? Do spouses get involved? Is this encouraged?
Majority of the time when I'm working with someone, their OCD is not just affecting them, but it's affecting the whole family, affecting a spouse, a child, a parent. So often OCD treatment really involves the whole family. The focus is really on the patient who is suffering with these symptoms to get them better, but also it helps to have the entire family on board to help them, encourage them, when they may see something going on that their loved one is doing that is, an OCD ritual. It would be okay for them to say, hey, are you doing an OCD ritual? Another problem that we see often in these families is a lot of enabling going on, and part of OCD treatment is trying to get everybody on board, so enabling is limited.
How would someone have an appointment with you?
Well, my contact information is located on several websites on the internet, especially the International OCD Foundation, which is a great website, by the way, for anyone who wants information about OCD or OCD-related disorders like trichotillomania, Tourette's syndrome, PANDAS, things like that. And there is a database for treatment providers. It's excellent. And I really believe that anybody who knows how to treat OCD knows about the International OCD Foundation. They know about the database. They're listed on the database. So I have a Facebook page. It's just called Carla Kenney, MALMHC. And it's really just dedicated to people with OCD or related disorder and their families and loved ones. And I post a lot of information about upcoming events, things that are going on. I'm vice president of OCD Massachusetts, which is an affiliate of the International OCD Foundation here in Boston. And we have started a lecture series at UMass Medical Center, and that runs from this coming September until June. And every month, the second Thursday of every month, we have a renowned speaker in the field of OCD who will be speaking for free for 1 hour, and then immediately following we have a couple of support groups that take place.
So where is your office located?
At 9 Cedar Street here in Worcester, Mass.
Here in Worcester. And you work with the team with Jennifer Lish?
Jennifer Lish, Helen Toronto, yes.
All right, well, thank you so much for coming on.
Thank you for having me.
I did enjoy it. Thanks again.
Thank you.
I am Ramona, and you've been watching Ramona Interviews. Have a wonderful week.